And welcoming all of you to the second edition of Being in the Virtual Space, but also the seventh year of MSF Asia Scientific Days. I've been asking myself, it's a big thing to kind of inaugurate a scientific day which has work from every part of the continent, which has lots of researchers, epidemiologists, healthcare workers who have contributed to building up these 2 days. So the first thing that has always inspired me, I'm quoting Louis Pasteur on this one. He said, science belongs to no country. And the knowledge is shared by, sorry, I need to go back to this one because I want to quote it right because I tried to paraphrase it, but science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. So through this scientific day, what we wish to do is like actually bring that equitable access to everybody and offer a platform where we build communities of practice, where we bring in people together who not only share the successes they have had in implementing certain concepts, be it innovative concepts, be it concepts working with populations that were having extreme challenges to access to healthcare, or bringing in new ideas about how to bring the patient at the center and not have patient as a beneficiary. So for us, this is what is the essence of the scientific days. So scientific days is a platform that we offer to the entire medical, paramedical, non-medical community, especially in humanitarian settings, to offer an exchange of ideas, exchange of learning experiences, learning from each other. I think peer learning is one of the learning that really stays on and sticks with us. So through this day, these days, we hope that we are able to contribute our very little bit to the scientific community on bringing science to life. I spoke last year when I spoke to you, I spoke about the information overload and the fatigue that has come with us being in the virtual space. And even though we still continue in the virtual space, maybe our way of how we look at the virtual space is changing. As much as it kind of takes away the aspect of being face to face and that human interaction, but it also brings in many more elements in there. So today, if you look at the 2 days we are kind of having, they have factored in all those learnings that we had through interactions, through feedback coming in from all of you. Simple things like making sure that we have live captioning, to have access to every expert during the day, either through lounges or bilaterally engaging with individuals because their information is available on the platform, which is relaying this scientific day live. So we hope that we convert this fatigue into an opportunity for future, and that's what our humble kind of wish is. And we really would like to hear from you at the end of 2 days. Did we succeed in really bringing that engagement that we were aspiring for? Aditi gave you a bit of introduction into what we expect today. But what I really want to highlight is about we are at a point of time. It's 25th of August. And this is a day which many of us remember because of the mass exodus of Rohingyas fleeing violence, and it has been 4 years. So if we look at in the neighboring countries, we are all battling COVID. We talk about India, we talk about Sri Lanka, we talk about Nepal, we talk about Pakistan, Bangladesh, Myanmar, Afghanistan. So in some places we are talking about the third wave, in some places we are still kind of experiencing the impact of second wave. So through these 2 days, we also want to bring some of those experiences in contexts that are rapidly changing. So while as much as we talk about populations in stable context, we also want to say 4 years of this Rohingya crisis and how these populations are dealing with other health issues of excess and still continue to be one of the most persecuted population in the world. Talk about Afghanistan. We recognize that our teams are on the ground and trying to offer as much as possible access to healthcare to our Afghan population who we have been supporting from last 20 plus years. So One of the key things that we wanted to kind of, apart from putting patient at the center, talking about patient centricity in humanitarian settings, we also wanted to talk about bringing in experiences, bringing in some examples on decentralized care, be it on Hep C, talking about what COVID-19 has done or is still doing on our health structure. So you will have through the days some examples, some research being presented to you, which has gone through a very, uh, I would say, stringent scientific rigor to be able to present you the best of the best that we could offer you from different parts of the world. The panels are diverse, the speakers are diverse, not only in terms of geographies, but also in terms of their academic backgrounds, in terms of whether they are implementers, strategists, innovators. So a variety is being hopefully offered to these 2 days to all of you. The last bit of it is that the most important thing is staying curious and not stopping questioning. So I hope through this platform in coming 2 days, you keep on engaging, asking questions to all of us to be able to learn and make maximum out of it. Thank you very much. And I'm very, very warm welcome to all of you.